Welcome to Geological Shop Talk. In this podcast, we bring you roughly 20 to 25 minutes of practical clinical methods, perspectives, and advice that has its work boots on. Listen in for clinical gems that you can begin to investigate the next time that you walk into clinic. Additionally, visit the show notes page for supporting materials from this week's guest on Shop Talk. All right, friends, roll up your sleeves. Let's get to work. This episode of Shop Talk is brought to you by LASA OMS, your clinic's partner in wellness. LASA has a special offer for you. Listen for it later in the show. The information shared on this podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified licensed healthcare professional before making any decisions about your health or treatment. The host and guests are not responsible for any actions taken based on the content of this podcast. Hey friends, welcome to this geological episode on our reproductive health series. I am delighted today to have Kath Berry with us. Kath is an Australian-born acupuncturist. She's a women's health specialist. She's been at it for 30 years, plenty of time in the boat. She's written a book. She's a co-author of Menopause, a comprehensive guide for practitioners, and she's got a website, treatingwomen.com. She helps clinicians all over the world work with women's health issues. She gave a TED Talk. This is provocative. TED Talk, Sexercise for masturbation. No, Sexercise for menopause, but it is about taking matters into your own hands. Fantastic talk. You might want to check that out. Today, we are here to talk about sexual vitality and health in the post-reproductive years. And there's three things, Kath and I were talking about this before we started rolling tape, there's really three things that we're going to talk about today: biology, mindset, and environment. These are really important aspects to pay attention to in so many healing environments. And today we're going to talk about it with sexual well-being. Kath, welcome to Geological Shop Talk. Great to have you.
Thank you for having me on the show, Michael.
So, let's start with biology.
Indeed. And I want to preface this just by saying when I use the term menopause, for today's purposes, I'm going to be talking about the whole menopausal transition. Sometimes people pick me up and say things like, do you mean perimenopause or menopause or postmenopause? But really what I'm talking about is that whole time frame, anything from the late 30s, early 40s through until the mid 50s. So it's almost like defining my terms. Menopause I'm using to mean the entire menopausal journey. So yeah, it really does start with the biology. We all know it's the changing in the hormonal landscape. And one of the things with this framework of the biology, the mindset, and the environment is we can start to look at what's actually happening for the woman herself, what's happening chemically. And so we're seeing those reductions of estrogen, the reduction in testosterone. So you're getting the physiological changes in the body. Most noticeably, a drying out. So the vaginal tissues, which are really sensitive to estrogen and collagen, start to become dry and they lose their elasticity. So that there's this sort of physiological change that can happen for some women. They don't even know it's happening. So it's not until, particularly if they don't have a sexual partner or they're not sexually active, it's not until they actually can sometimes get pain or it can show up as cystitis, that there's this sort of sense of frequently needing to urinate, but it's in fact this vaginal atrophy which is taking place. It's quite literally the tissues are dying off. So that chemical change in the body can have these downstream effects on a woman's biochemistry, on her sexual desire, but also on the vaginal tissues. And what that then leads to is potentially sex can become painful. So that then leads us into the next thing, which is the mindset.
So tell us more about that. Tell us what can be done in the biological area.
So topical estrogen is one. So there's a big thing about prevention more than anything else. So one of the things that I always say is I give a talk where I talk about vagina being like a tube. And so it varies significant in length. But the real thing is about retaining that stimulation to the vaginal tissue. And that's obviously where the talk of masturbation comes in, that the evidence shows that penetrative use of a vibrator activates those deep internal vaginal wall and the tissues, and it keeps everything moist and lubricated. So that's a really critical aspect of remembering that it's actually the physical contact with the vaginal tissues which can maintain good vaginal health.
So what I think you're saying is like any other muscle, like any other part of our physiology, the more you use it, the more you can, the less you use it, things atrophy, things change.
Exactly. It's that use it or lose it. That's the punchline of, if there's anything to remember from today's talk, it is encouraging women to use it or to use it or lose it. And the thing that this, again, we're moving into mindset, the thing that really distresses me is when you hear women say, I've lost my sex drive, but that's okay. As if sex belonged to a different era, and not realising that it's not just about this idea of sexual pleasure. It's just recognising that these are physiological tissues, and that if they are less let to atrophy, that it can become deeply painful and lead to other things like urinary incontinence, which of course has its other sort of social implications. So your mindset is a woman's own relationship with her body. It's her own relationship to her desire. It's a willingness. It's a recognition that this is in fact really important. And sometimes I would hear my patients say things like, again, that I've lost my libido, but I'm fine with that. Gosh, if you lost your appetite, there'd be a cause for alarm. But it's this idea that losing your sexual appetite because it's discreet and private, it can just go by the wayside without people recognising how significant an issue that can become. So mindset really is an important part. And of course, as we know, that mindset is also around arousal. So that there is a huge element of sexual desire, which is a person feeling confident, a person feeling energised, recognising that all the systems at home have to be in balance as well. And again, that's that third element we've been talking about, and that's the environment, the setting.
I think what I hear you saying is internal environment and external environment and mindset all play a really important role here. What about things like sleep or diet, other lifestyle habits? How does that fit in here? Or herbs for that matter, or other kinds of treatment? How does that fit into this piece?
It fits in perfectly, and that's again this environment. So we've now got the person, their chemistry, how they're thinking, how they're feeling, and then that third element is what is going on in their life. And this is where it gets really murky because, of course, that big age range from 40 to 55, there's a huge amount of shifts that are going on, not just from a physiological perspective, but also socially. For some people, it might be raising teenagers. It might be taking care of elderly parents or the bereavement of a parent.
Yes, or both.
Or both, that one leading to the other, this sort of feeling of like real life catching up. And as you say, that the first thing that's going to be affected is sleep. The other thing, incredible spike in stress hormones. And then what can happen is women start, say, drinking more alcohol or looking for other forms of trying to medicate that stress in their life. So it becomes almost like this soup of all these different things which are contributing to the problem. But that environment, as you say, that managing the sleep, managing stress, looking at what can be done within the household, looking at whether within the workplace is another one. Women are often either starting to move towards more senior roles, or some women express a huge frustration about being sidelined at that point in their career. So it's, again, all the other elements like a mosaic which start to form a picture of someone. And of course, when somebody's under stress, the last thing they're going to be thinking about is sexual desire or arousal. It's from a very primitive sense that we get deprioritized as our sexual pleasure becomes almost a luxury. Or to some women, again, I've seen that it falls so far off the list of priorities that it doesn't even feature as something to be concerned about, which upsets and concerns me as a clinician.
Yeah. I think we see this both with women and with men. To some degree, changes in biology, changes in physiology, work, family responsibilities. I mean, there's a lot more going on in our lives in our 40s, 50s, 60s than was going on in our 20s. There was a whole lot more time for fooling around when we were younger. So there's that piece.
It also comes down to that idea of what relationships are people in. So again, it's if they're in a long-term partnership, that has very different challenges than if somebody's newly single, for example. But you've just put that together around what's the difference between being in your 40s and 50s versus being in your 20s. And one of the most significant one, and that's a good take home from today, is recognising that we don't have spontaneous arousal or spontaneous desire, which is that feeling of being chemically aligned with somebody or being aroused by smell or looking at somebody and finding them attractive. All that actually starts to wane after those reproductive years. That's a physiological response for the body to partner and procreate. So it doesn't exist after a certain period in your life, and that people expecting to be turned on by looking at their partner naked is probably not going to happen. But the comfort is to know that there's a thing called responsive desire. And that is that women are likely to become turned on if they are touched, if they feel safe, if they're relaxed. So what it means is the roadmap to a sexual engagement is different. It's not going to be a look across a room or a spontaneously, let's have sex tonight. It is going to be next Tuesday at 8 o'clock after we've watched the TV, after watched telly or we've done the dishes. Why don't we set an hour and a half aside to have sex? And some people think that's like the murdering their sex life. And I actually think it's the opposite. It's how to keep a sex life alive is by scheduling sex and recognizing that it is something that's going to take work, and both parties have to be interested enough to want to put that time and investment in. Recognizing this responsive desire or this responsive arousal means that you've really got to get started. And some women say it can take them half an hour before they start getting turned on. That's a big investment of time, but it's recognizing that it's almost like a fire, that rather than in the trees and everything's burning on a very superficial level, it's this sort of like a pilot light that just needs this sort of little gentle stoking of the fire. And again, it's eliminating that problem of sleep, eliminating the problem of alcohol, of anxiety, of work stress, and really just making time for it.
Okay, this is really interesting because I think about in the 20s, you've already got a bonfire raging. It's not like there is no pilot light. The fire's already on. It's just a matter of what can I go burn down? And yeah, thinking about someone in their earlier years, oh, let's schedule sex. That's a great way to turn it off. What I think I hear you saying is that as you get into these later years, being intentional about it, maybe that means scheduling, maybe that means setting aside. It means a kind of cultivation, so to speak. And it takes time to get the fire going.
100%, Michael. You've just hit that so eloquently. And it really is about cultivating. And it's that intent, that investment, that recognizing this is important, and particularly for relationship connection, that it's once the sex goes from a relationship, it's very difficult because it is a form of communication. It is really difficult to maintain that level of intimacy. And of course, then what happens is in this age of digital with all these apps, there's the access to sex is it's the desire for intimacy, which is really difficult to find, and that human connection. And this is something that we have to encourage our patients to understand the value of that, the value of maintaining that within a relationship. And that aside, not even within a relationship. And you mentioned earlier the TED Talk that I was involved in, that was looking at masturbating, because my whole interest around when I was writing the menopause book was a lot was talking about women who are sexually active fare better through menopause. And I was thinking, that's very heteronormative. And that's implying that somebody's still in a heterosexual relationship. So when I drilled down on the research, it's penetration of the vaginal tissues. So that's why there's some really fantastic research coming out of the US, which is looking at activating those vaginal walls with a vibrator. And so that's why I came up with this expression, sexercise. I think what a great way of just saying to people, so it's not even necessarily about having sex with a partner, it's about recognizing that sexercise, that actively encouraging stimulation of the vaginal tissues is so healthy for a woman. And I think also that working on the idea that a woman's relationship with herself is really important. And then, of course, all the research then shows that women who are masturbating are more likely to have active sex lives with partners. So everybody wins.
Yes, it's win-win. There's the physiological benefits of masturbation. It's funny to hear you talk about, heteronormative, that we can just throw that out the window, patriarchy, blah, blah, blah. Oh, wait, there might be some wisdom in keep knocking boots and have vaginal penetration and work on your intimacy, not just sexual intimacy. But I think we all know this as we age through the years, that getting to know somebody else, it's a funny thing. In some ways, you get to know them more deeply, and it's a turn on. In some ways, you get to know them more deeply. I'm not going to say it's a turn off, but because you know them more deeply, it's almost like, what is there to explore now? And it's that sense of shared exploration that I think really makes intimacy keep a flame going.
100%. It's lovely. One of my new jobs more recently is I've become the sex education teacher at the International High School here.
Wait, did you say high school?
Yeah, high school, 12 to 15-year-olds. And so what's been funny is that I spend a lot of time talking to middle-aged women about sex. And now I'm talking to teenagers, these sort of early teens. And so it's really fascinating to be at these sort of the bookends of these sexual experiences, right? These little young ones at the beginning and that the fire burning, as you're saying. But one of the things that I had to do within the framework of the curriculum, certainly that I've been developing for these kids, is making sure they understand sex isn't just about the sexual intercourse. And we talk about sexual arousal and the idea of touch and intimacy. And particularly, one of my jobs is to teach these kids boundaries and consent. So making sure they understand that any form of contact, and it doesn't even have to be physically touching, but coming into somebody's space, and that recognition of what's been lovely is to help form this framework of when we talk about sex, what do we really mean? And when we talk about intimacy and when we talk about connection, what I have loved is exactly what you're saying, is broadening their minds to understand that sex is really this incredible spectrum and that it really is about this magnificent thing called human connection.
I want to come back to sleep for a moment because it is so key to so many things. We've had a few people on this reproductive series already talk about sleep as a key pillar of helping people in all sorts of ways. And I think that's true with just more than reproductive health, and it's more than just life transitions. Sleep is really important in many ways. What are some of the ways that you find helpful in helping people with sleep? Are there some perspectives that you ascribe to? Any particular herbs or formulas that you tend to use, or are you just applying your Chinese medicine diagnosis and going from there? How can people attend to sleep and help their patients with that?
Well, I'm a huge advocate for exercise. I think that one of the problems we see with sleep is this sort of agitated mind syndrome. So the idea that it's rumination and stress, anxiety, overplaying things. So I'm a really big advocate for the women I work with, making sure that they are doing really routinely scheduled exercise. That it's just, to me, that's been probably one of the biggest findings from the research, is just the benefits, really. And so that's, and the other thing as well was for a lot of people recognizing that they just, things like mindfulness meditations is another big one. So it's the idea of repetition. So rather, the treatments themselves having acupuncture is one thing. But for example, something like a Tara Brock, who does a rain meditation, recognize, allow, investigate, and nurture. I can share the link with your audience in the show notes. It's a 20-minute exercise where it's a really simple way of unpacking an incident that might have happened during the day. But I make sure that all my clients have access to that so that they can either do it sometimes while I've got the needles in. If they're telling me about something that's distressed them, we say, do you want to do a rain on that? And that recognize, allow, investigate, nurture framework, just giving people a way of, it's almost diffusing little bombs, that it's going in and cutting the wires that might be fueling something which is in the wee hours of the night turning into overload. But I am really curious, and my next sort of movement is now looking more at mental health. I'm really fascinated by anxiety and depression. I'm really curious about microdosing. I'm looking at mushroom products. That's something perhaps you and I can have a conversation again in the future once I've done more of a deep dive into that. But I am seeing a huge amount of anxiety and depression showing up in my menopausal patients. And so then it's looking at things like, okay, you have to cut back on alcohol, which they often go hand in hand. I'm feeling anxious, a couple of glasses of wine, help put me to sleep. Mm-hmm. And that's obviously interrupting that sleep cycle because it's...
Yes, but it doesn't keep you asleep.
Exactly, because it's such poor quality sleep. Or it's that sort of waking in the middle of the night. Yeah, sleep is a big one though. Fatigue is a really big one. It's a really chronic problem for many people.
So as an acupuncturist, as a Chinese medicine practitioner, I'm not surprised to hear you attending to the environment that a person is in, both the external and the internal, and what people can do to help themselves. You mentioned mushrooms. Are there any particular herbal formulas that you tend to lean on?
So I have a tendency, I work really closely with a herbalist. So I'm really big on making sure that I refer when it's not within my scope of practice.
Okay.
Yeah, no, hence why I lean more on the physical sides of things. So in my practice, I do acupuncture, tuina, and cupping. So my treatments are very physical, but that's why I'm always looking for those things like a meditation that I can give to somebody to go home and do, then I think that those little exercises, the little take home. The other thing which I do is I give the music which I play in my acupuncture practice has been written by a client of mine. It's called Points of Stillness, and it's magnificent. So what I do is I make sure that my clients also have access to that so that they can go home and play the same music to trigger the same response, that it's when you're in bed tonight, replay this soundtrack and it's going to bring you back.
This is what you heard in the acupuncture clinic. Yes, yes.
That's exactly. So that idea of just when you're in bed, imagine yourself having acupuncture right now.
Oh, it's perfect post-hypnotic suggestion.
It is. And acupuncture, as we know, is accumulative. The more somebody has, the more they get that instant response. So it's giving somebody permission to allow themselves physiologically to experience that as well.
That's a great idea, giving out your playlist.
Yeah, isn't it?
It is.
Look, I sometimes do it myself. If I'm finding it really hard to sleep, and it's one of those things that's my go-to is putting on the same music because it's me in my clinic environment. And again, when you hear it, Michael, magnificent. And it was specifically crafted for acupuncture and healing treatments. So it's been curated by a patient of acupuncture to help enhance the experience of these treatments.
Great. Let's put it on the show notes page. Send me a link to it.
Will do.
Sounds good. Kath, if people want to know more about what you're doing and where to find you, what you're offering these days, where do they go?
Fantastic. So treatingwomen.com is my portal for all my education offerings. And I am so excited because I've just spent the last couple of months going through my archives and I've managed to curate this incredible new course on menopause and fertility. So it's advanced hormone health. And it's basically everything and everyone that I've ever interviewed around looking at the entire female reproductive system and post-reproductive years. So it's really exciting. I've just had the most wonderful time revisiting with old colleagues. And one of the things I love about Chinese medicine is its complexity and its simplicity. So I've really loved being able to go back and listen to these things, which some of the recordings are 10 years old. Lillian Pearl Bridges, for example, who talks about face reading. And now watching it since her passing and just thinking, what an incredible educator, what an incredible piece of work. And we've still got this body of knowledge that we're building on.
Yes, absolutely. This is the wonderful thing about the medicine that we practice. It's evergreen. You can take materials that you were working on years ago. It's still relevant. It's still useful.
And it's lovely. Do you know, I'm a keen gardener. And the other day I found some photographs of my garden. I've been in the same house nearly 10 years. And I just forgot that my garden was built. It's just this sort of continuation of the same. But I feel like Chinese medicine has so much the same. It's this idea that we're still cultivating. It's this growing thing. And sometimes you don't see how much it's evolved until you stop and look back. But those sort of early days are just as relevant.
This is one of the benefits of aging, opportunity to pause, look back and see the distance that you've come. Absolutely. Yeah.
And this incredible network as well. How fortunate we've got all these incredible people in our professional lives. It's such an honour. So thank you again for your work. And I've loved the Geological podcasts because I get to sit here in Europe and listen to all these wonderful people that you've had on the show.
We're lucky to have the technology to have a big digital campfire that goes around the world. Yes. Well, Kath, thanks so much for joining me today. And I look forward to the next time we get together.
Indeed. Thanks again, Michael. And thanks for the whole team, all the people behind Geological. It's just such a wonderful resource. Thank you.
When practitioners reach for a Chai Hu Guizhi Tang or Shao Qing Long Tang, they need quality that they can trust. Lhasa OMS supplies the herbs your clinic needs to be ready for the cold and flu season. Visit Lhasa OMS to source the classical formulas featured in this series. Use the code REMEDY20 for 20% off your next purchase at LhasaOMS.com. Some exclusions apply. See the website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.